We are here today to talk about leukemia, a common form of cancer that many of you are most likely familiar with. According to the Leukemia Research Foundation, leukemia is a rapidly progressive cancer of the blood, characterized by the uncontrolled proliferation of immature blood cells, which take over the bone marrow and spill into the bloodstream. The leukemia cells can't do any of the work of normal white blood cells. Leukemia is the most common type of cancer in children and adolescents younger than 20 years, accounting for 26.7% of all types of cancer found in this age group. Leukemia represents 3.1% of all new cancer cases in the U.S., and it is present in four main types.
Leukemia replaces mature, functional leukocytes with immature, ineffective leukemia cells. This means that the body cannot defend itself from diseases properly. Moreover, the leukemia cells do not degenerate at the same rate as normal functioning cells, so they remain in the body for a longer period of time and reduce the efficiency of the immune system.
Along with progressions in cancer research and viable treatment options, the 5-year survival rate of leukemia has risen 23% from 1975 to 2014. Now, this number reflects all ages of people affected by leukemia, but clearly survival rates change with age. In general, the number of incidences increases as age increases. However, children under the age of 5 are more susceptible to leukemia than those ranging in age from 5 to 20 years, most likely stemming from their underdeveloped immune system. The highest levels of susceptibility occur in elderly patients over the age of 75. Overall, because of the weakened immune system that age brings with it as it increases, the survival rate of leukemia patients decreases after about the age of 30 years old. Before this time, the survival rate increases as the immune system strengthens. By race, Asians had the highest survival rate, followed by Hispanics, American Indians, blacks, and whites. By gender, males seem to have a lower survival rate than females, as out of every 100,000 patients, 4 more males die than females. Projected for the year 2014, 24,090 people will die of the disease, 14,040 of which are males and 10,050 of which are females. Out of the projected 52,380 new cases, a survival rate of 57.2% is accurately represented.
The exact causes of leukemia are not yet known to scientists who do work in the field. Most likely, the usual suspects do the most damage. Radiation and exposure to X-rays and gamma rays increase the likelihood of leukemia development, as do known carcinogens such as cigarette smoke. Also at play are chemical compounds like benzene and harmful ultraviolet light. These factors cause mutations in cell DNA, which helps to form leukemia cells.
One common treatment of leukemia is chemotherapy. This is used to kill cancerous leukemia cells. However, it affects other cells besides the diseased ones, leading to their death. Specifically, chemo drugs such as vincristine, tinipicide, etoposide, and many others target cells that divide rapidly, including cells of the stomach lining and skin cells. Chemo is effective when it comes to destroying cancer cells, but because it fails to kill all of the diseased cells, and because it destroys the immune system, relapse is likely and occurs in around 50% of all leukemia patients. Because of its side effects, chemo is neither a sustainable nor long-term treatment for leukemia. One alternative treatment that is not commonly used and is still in the development period involves the combined use of chemotherapy with stem cell transplant. Chemotherapy is used to kill all diseased cells in the bone marrow, and then matched healthy donor stem cells are injected into the bone marrow. These healthy cells then produce healthy blood cells in the place of leukemia cells, effectively destroying the disease.
Yet another alternative treatment is the use of aids to attack cancerous cells. In this treatment, a disabled form of the human immunodeficiency virus, or HIV, is inserted into the patient with modified genetic material to detect the antigens presented by leukemia cells. The HIV enters healthy bone marrow cells and influences their genome and therefore gene expression. This new gene expression leads to the creation of new T cells, which are programmed to kill leukemia B cells, leading to the complete eradication of the leukemia cells. Because T cells create memory cells, they will be able to attack B cells with the leukemia antigen if relapse occurs. Although all of these treatment methods act to destroy cancerous cells, the alternative treatments provide a more specific method that reduces risk for healthy body cells, as well as creating a longer-lasting effect by influencing the foundations of the immune system.
One hope for the future of leukemia treatment is based off of the genetic engineering of leukocytes, specifically cytotoxic T cells. Current research supports the use of genetically engineered immune cells in the fight against leukemia. These cells are taken from patients and modified in a laboratory setting to exhibit specific antigen receptors. They are then injected into patients so that they can circulate in the bloodstream. Because leukemia cells display specific antigens and proteins on their surface, these modified T cells with antigen receptors specific to cancerous leukemia cells bind to their respective cells and destroy them. Although a primitive form of this treatment is in use today in some rare instances, the hope is that it will be used more frequently in the future to provide an easier, more efficient, and safer means of protection.
In the future, we hope that other treatments arise. One such treatment would be the use of other viruses that cause the body to turn on itself, such as autoimmune diseases or immunodeficiency diseases. These types of diseases can be used similar to HIV to create T cells that will attack B cells and rid the body of leukemia cells. As more of these types of viruses are used, the treatment of leukemia will become faster and more efficient, possibly leading to the saving of lives.
One last hope for the future based off of current research involves a drug taken in tablet form that can drastically diminish the effects of leukemia. Because leukemia is such a broad form of cancer that encompasses many types, different medical treatments are used for different variations of this cancer. One such treatment, a drug commercially known as Gleevec and chemically known as imatinib, is used to treat chronic myelogenous leukemia, among others. This specific type of leukemia has much of its roots in the Philadelphia chromosome, and Gleevec manages to reduce its effect on patients by binding to and inhibiting a tyrosine kinase that transfers phosphate groups from ATP to a protein in a cell. Without the kinase in functional form, the cancerous cells die and the effect of the disease drastically diminishes. Gleevec is the first drug of its kind, and it remains a hope for the future that more drugs like this will come our way.